Welcome back to Nutrifit Hacks. Today we discuss a common problem, uterine fibroids. What are uterine fibroids? Uterine fibroids are just tumors in the uterus, and this can be seen in women in their reproductive age group. So right from menarche till menopause, one can be diagnosed with uterine fibroids, which are by and large non-cancerous conditions. What are the signs and symptoms of uterine fibroids? The signs and symptoms of fibroids can be heavy menstrual bleeding, pain during the menstrual cycle, and an enlarged uterus presenting as a mass. You may think you're just gaining weight in your tummy, but actually they are growing fibroids in your uterus. Large fibroids can cause pressure symptoms in the bladder, making you go to the washroom often. They may also put pressure on your rectum, causing constipation or a feeling of heaviness. Some fibroids can cause postmenopausal bleeding. Sometimes fibroids can cause infertility. These are the common signs and symptoms of fibroids. What can cause the condition of fibroids in the uterus? Well, the exact cause is unclear. Several theories suggest that genetic and epigenetic factors play a role. Some cells in the uterus have a different genetic makeup, which predisposes them to form fibroids. These genetic variations, along with other factors, contribute to a higher tendency for certain women to develop fibroids. How common is fibroid? Well, it's not very uncommon. A study found 25 to 30% of patients had fibroids, whether symptomatic or not, so fibroid is not very uncommon and can be seen in many women. How are fibroids diagnosed or tested? Fibroids enlarge the uterus, so we start with an examination. We do an abdominal examination and a vaginal examination. The commonest investigation is ultrasound, which is very good for diagnosing fibroids. It shows the number, location, and size of fibroids. If ultrasound isn't enough, we advise an MRI, which gives a clearer picture for diagnosis and treatment planning. Are fibroids treatable, and what are the options? Fibroids are treatable, but the type of treatment varies. Some women may not require any treatment. Visit your doctor to determine which is best for you. What is the impact of fibroids on the quality of life of a woman? Women suffering from fibroids experience significant discomfort and pain. Fibroids are non-cancerous, so surgery isn't always urgent. However, the bleeding and pain during menstrual cycles severely impact their quality of life. Can fibroids lead to infertility? Fibroids and infertility do exist together. Often women unable to conceive have fibroids, but not all women with fibroids will never conceive. Location matters. Fibroids in the uterus cavity can prevent conception. They may have recurrent abortions or not carry to term. Remember, not all fibroid patients will present with infertility. Do fibroids cause problems during pregnancy? It depends on the size and location of the fibroid. Some women can continue their pregnancy with little discomfort, but large fibroids can cause miscarriages or preterm delivery. Fibroids can also grow during pregnancy, changing shape and size. At delivery, fibroid location can complicate normal delivery. Sometimes a cesarean section is necessary due to fibroid obstruction. Thanks for watching. Subscribe to Nutrifit Hacks for more health tips. Like, comment, and also share. Goodbye.